We begin tonight with a quote. Crisis of patient care is the phrase. It's in the Urology Department at Dunedin Hospital. That description came from Dr. Stephen Mark, the head of the Urological Society of New Zealand, who last night listened to Checkpoint's coverage on what was happening at the hospital and today called the DHB to offer his help. As revealed last night on this program, frustration with long waiting times for treatment saw the DHB commission an independent review into its own urology department. This follows our stories last week identifying a shortage of ICU beds for post-operative care as being responsible for delays and cancellations to operations, including for patients with heart conditions. Now, at the time, the hospital CEO told us there weren't enough ICU beds, but said the number is being increased. Last night, he told us a review of urology will help the DHB get that department working more effectively. But surgeons and external medical experts say it's not before time. So too do the patients themselves, like this Dunedin man.
Urinary tract completely cut off.
This is Dave McLean. In 2015, he was suddenly hit by the most incredible pain. And what was the cause of that? Did you have an enlarged prostate?
Enlarged prostate, yeah.
So the prostate was so enlarged that it was actually blocking your urinary tract?
Yeah, blocked it. I got a major prostate infection on top of the enlargement that was there. And the combined effect caused urinary tract to cut off completely.
The pain, he says, was in a different league from anything he'd ever experienced before by a considerable margin.
And it was extreme burning. Yeah, it was as if the penis was immersed in boiling water.
A catheter was inserted, then taken out. The pain returned. The catheter was reinserted. And this time it stayed in until Dave had surgery, thanks to his employer having staff health insurance.
And the price of the surgery without Southern Cross cover is around about $10,000.
Wait a sec, the price of the surgery, why didn't you have this in the public system?
Yeah, we would have to ask the public system. It would seem, when I asked my GP, if it was normal to go so long with a catheter before deciding, he said that, well, in his opinion, it would not be normal, but that's just the way the public hospital system was.
How long did you have a catheter in for?
5 months.
5 months. And when the surgery was finally done in a private hospital, Mercy, who was the surgeon?
KP Somalia.
Who was also a urologist at Dunedin Hospital. Are people waiting too long?
Yes, I think so. Some people are waiting too long, yes.
This is Dr. Kamta Somalia, one of 3 urologists at Dunedin Hospital, but between them, they only work 2 FTEs, full-time equivalent jobs.
So if all 3 of us at Dunedin Hospital were full-timers, working full-time, we probably will just make it.
But in fact, 3 of you are doing 2 full-time equivalent jobs.
Exactly, absolutely.
Which means you are not getting enough hours to keep up with demand.
Absolutely, I agree with you, yeah.
Checkpoint has been repeatedly told, both on the record and off it, that there simply aren't enough surgery hours available in the urology department at Dunedin Hospital. And what does that mean in terms of delays to treatment?
Obviously, when the work coming in and the number of people going on the waiting list are far much more than what we can service with 2 FTE.
2 full-time equivalents?
Yes.
Dunedin Hospital has 2, Nelson Hospital and Palmerston North Hospital have 4. Everyone we've spoken to has told us 2 is nowhere near enough.
And we just are not getting the resources we need. We do not have the full-time equivalents we need.
That's Dr. Alistair Hepburn, another of the specialist urologists at Dunedin Hospital. Are you saying as a result of only having 2 full-time equivalent staff, people with cancer are having to wait longer for treatment than is appropriate?
At the present time, that is one of the major problems, yes. It's not the only problem, but it is one of the major problems.
People with prostate cancer?
Correct, yes.
Other forms of cancer?
Definitely, yes.
Last night on Checkpoint, the Southern DHB CEO, Chris Fleming, told us a review was being conducted into the Urology Department at Dunedin Hospital. But what we didn't know then was whose idea it was. I asked Dr. Alistair Hepburn, Who suggested that review?
It was a suggestion from myself and my colleague.
In short, the surgeons themselves were so frustrated by their situation, they asked for the review.
So that was something that we demanded, we asked for, and pleasingly it has happened, but not without a lot of pressure.
The review's due back within the next week or two. The urologists are grateful the DHB agreed to it, but what they really want is some more staff. This is a difficult question for you to answer, and
Sure.
You are in a master-servant relationship with the Southern DHB, even though you are a senior urologist. But do you feel like there are real financial pressures driving what appear on the face of it to be insufficient staff numbers?
I can say that's the feeling I get, yes.
Last night, Stephen Mark listened to our interviews from Checkpoint. He's a urologist and chairman of the Urological Society. So concerned was he by what he heard on our program, he phoned the CEO of the DHB.
And I've certainly spoken to Chris Fleming today, and I've agreed to be directly involved with trying to improve that care by being involved in the implementation of any change.
So change appears to be coming, but it's taken a long time. And in the meantime, Stephen Mark, what do you think it's like now in the Urology Department at Dunedin Hospital?
Look, I think there is a crisis of patient care because they've got concerns about the inability to deliver the care in the time frames that they wish to do so.
A crisis of patient care. That's the chairman of the Urological Society of New Zealand talking about a public hospital. The DHB denies this, but outside the most senior levels of hospital management, every single person we've spoken to, including the urologists themselves, says it's principally a question of resourcing. You can't do surgery without surgeons, and in full-time equivalent terms, Dunedin Hospital has two.
And that's really quite inadequate.
Stephen Mark, or as Dr. Alistair Hepburn put it.
Yes, if we got more funding, our service would be in a much better situation.
And people wouldn't have to wait as long?
Absolutely.
It's one of the urologists at Dunedin Hospital. The Health Minister, Jonathan Coleman, was unavailable once again to be interviewed tonight. The Prime Minister, Bill English, was in Dunedin today. He told our reporter Ian Telfer that if the DHB can't meet its target times for operations, it should be making arrangements for the surgery to take place elsewhere.
There are requirements about when the service should be available, and I would hope that anyone who's diagnosed with a significant illness in that way gets the service they deserve, and if there's a problem in this individual case, then it needs to be taken up with the GP or the hospital.
But the DHB has now admitted there are 10 cases like him of people waiting more than 5 months. What's going on there?
Well, you need to ask the DHB. I mean, they're responsible for providing services. They've got some targets they are meant to adhere to, which represent good service for the public. And I would hope that if those 10 cases aren't getting the service here, then the DHB make sure they get it somewhere else.
Before that, we had thousands of eye appointments that were delayed. We've also had, they've admitted themselves, too few ICU beds. Aren't we getting to a point where we have a crisis at Dunedin Hospital?
I haven't seen evidence that there's a crisis. They are going to be, in the position where they're dealing with unsatisfactory facilities there, at the same time as there's a lot of work going on about how much to invest in the facilities now, knowing that there's going to be a rebuild in the near future, and those are decisions that the management there will need to make.
Do you have faith in your minister, your health minister? Because he won't talk to us. He hasn't talked to us for a week on this.
Oh yes, I do have faith in him. I mean, the running the public health system is a very large, complex task. But I also have faith in the professionals and the management who run the frontline services, because every day hundreds of thousands of New Zealanders are getting very good service. Where they aren't, of course, people should be moving to remedy that.
After 6 o'clock tonight, we'll hear from the acting head of Dunedin's emergency department, who says it's unthinkable the Southern DHB is paying surgeons to do nothing. Well, you just heard from Bill English. We won't be hearing once again from Jonathan Coleman, but we are being joined now by the Southern DHB Commissioner, Kathy Grant, who has been listening to all of that on the phone. Kathy Grant, thank you so much for joining us. You were a ministerial appointment back in August 2015 after the Health Minister sacked the DHB board. That's right, isn't it?
Yes, that is correct, John.
Right. What do you say to Bill English's recommendation that you need to make arrangements for those patients to get surgery as soon as possible?
I think that I would prefer to take that conversation one step back, John. And as you are aware from your telephone discussion last evening on Checkpoint with the Chief Executive, the review that has been the subject of much comment has been initiated. It will be with us next week, as I understand it, and I will be looking to the Chief Executive to bring to me plans for implementation in order that we can plan pathways forward for patients.
Right. In terms of the patients themselves, who probably aren't interested in pathways and more interested in surgery, what is it you recommend they do?
I am not in a position to comment on individual cases. I would, of course, I'm most concerned about our patients. The delays that have been described are indeed very regrettable. We need to identify the actions that can be taken and to address the issues that
the actions that can be taken surely are for the hospital to do what a hospital exists to do, and that's operate.
That is correct.
I'm just a bit confused about all of this. You are now pinning your hopes on a review that the hospital really had to be forced by their own surgeons into undertaking. You have two full-time equivalent...
If I may correct that statement, the preparation of and the undertaking of the report was as much initiated by the DHB as by the urologist.
Okay.
It was in both of our interests to understand what the issues were in the delivery of that particular service.
Aren't the issues really simple? And there are some discussions around inefficiencies, but the issues are simply that you have two full-time equivalent urologists, right? Nelson has 4. Palmerston North has 4. Why does Dunedin have 2?
Well, that is a clinical issue that, as Commissioner, I am not in a...
It's not a clinical issue, is it? It's a financial issue.
Well, I'm not... you would need to have a conversation, or you would... it would be more helpful if you were to have a conversation in relation to that matter with our Chief Medical Officer. But
we've spoken to your Chief Medical Officer. Look, I'm so sorry to interrupt, but we keep talking to people who shimmy around the buck. We've spoken to your Chief Medical Officer, who admitted that things in some respects, particularly around ICU bed numbers, aren't as he would have them. We've spoken to your CEO, who is very forthcoming and comes on when we ask him, and he has said he is not satisfied with waiting times, and he is not satisfied with what's going on in the Urology Department, and he is not satisfied with ICU bed numbers. We keep hearing this. Now, I look at your appointment by the Minister in June 2015. You were appointed to address a deficit. You were given financial KPIs. In July 2015, your employers asked to pay you more money because of the very unpopular decisions you might have to pay. And people keep telling me they don't have enough money to do what they need to do. Now, the buck for that stops with you, doesn't it?
Absolutely. And I have articulated that our challenge is to make the Southern District Health Board sustainable and reposition it in such a way as it is sustainable.
Financially sustainable? What about financially?
If I might finish,
surely.
Sustainability is a measure across, in my view, 4 dimensions: financial, clinical, quality, and our workforce. If we focus only on any one of those, we will have failed. It would have been when the Commissioner team was appointed in June 2015. The deficit could have been eliminated by a slash and burn exercise. That was not a pathway that we chose. It's a question of repositioning Southern in such a way as to be a sustainable organisation. So the driver is not simply a financial one.
If we look at some of the targets that the ministry has. For example, after formal diagnosis of cancer, meaningful treatment within 31 days, the longest kind of calendar month. If Paul Schofield has now been waiting for over 4 months and has absolutely no idea still when his cancer is going to be treated, is that satisfactory, do you think?
No, it isn't. It isn't satisfactory. The comment that I would make is that Southern has suffered from really years of underinvestment and significant deficits. So the pathway forward is going to take a period of time. There is no
which is look, absolutely, which is all very well and good when we're talking about financial KPIs and deficits and budgets and bringing things in under what the government requires of you. But if you have prostate cancer and you are waiting for treatment and you don't know when it's coming, do you think that you want to even hear those discussions taking place?
Probably not. I acknowledge that the delays are regrettable, that the patient groups that you have been talking to do need their surgery. We are making progress. We are investing in the future of Southern DHB and initiating change.
That is Cathy Grant, who is the Southern DHB Commissioner. We really appreciate you joining us this evening, Cathy Grant. So we have had the hat-trick from the South. We have had the Commissioner, we have had the CEO, and we have had the Chief Medical Officer. All that is left is the Minister, Jonathan Coleman, who consistently says no to our invitations to him appearing on Checkpoint. This does increasingly look like a financial consideration. The buck for that surely stops with the Minister, and we do invite him once again to join us whenever he can.